Okay, class, so hopefully you're getting used to medical terminology and how to read medical terms now. We continue with Chapter 3, Suffixes, and same chapter goals, define new suffixes and review those presented in the previous chapter. So now we're building a foundation. So let's start with Chapter 3. Now we go into combining forms. What is abdono? That's the abdomen. Acro means extremities. Acu means sharp, severe, or sudden. So see, sometimes these combining forms have three different meanings. Adeno or adeno is gland. Adipo, adipose fat. Amni is amnion. Angi, like angioplasty, right? Vessel. Arterio, artery, like arteriosclerosis. Arthro, arthritis, joint, right? Inflammation of the joint. And axillo, or axil, is armpit. So understanding these, you're getting used to it. And again, make sure you make flashcards. Make sure you're doing repetition. You have to see this at least 7 times to even remember it. Life, like biology. Blephar, eyelids. So you can actually have eyelid surgery depending on what you want, but it could be called a blepharectomy or depending on what they're doing. Okay, broncho is bronchial tubes, bronchitis, right? So that would be inflammation of the bronchial tubes. Carcinoma or carcin is cancer. Cardi means heart, not Cardi B. Chem is drug, so chemotherapy is chemical drug therapy. Chondro is chondrocyte or cartilage. Chron, now remember, chondro is cartilage. Chron, like chronological order. Chrono is time. Colo is colon, and cyst is urinary bladder. So cystitis would be infection or irritation of the urinary bladder. Encephalo as brain, so encephalitis is inflammation in the brain. Erythro, red. Hemo, blood. Hepato, like hepatitis, right? So that would involve the liver. Hydro, hydrate, right? So those are examples of water. Ingun, like inguinal, that's your groin. Isk, to hold back. Okay. Lapar is abdomen, so laparoscopy, depending on where you have your accent. That would be something that you would do to get into the abdomen. Laryngeo, that's larynx, and leuko, like leukocytes, it's white, so white blood cells. Lympho or lymph. Mammo is breast. Masto is also breast, so mammo and masto. So mastectomy, and then a mammogram. Morpho is shape or form. Muco is mucus. My is muscle. Myel is the spinal cord. So see, my is just muscle, but myel is spinal cord. Necro is death, so necrotizing fasciitis, flesh-eating bacteria, so necrotizing, death, right? Nephro is kidney. Nephrologist is a kidney specialist. Neuro is nerve, so neurologist is a nerve specialist. Neutro is neutrophil. Nucleo is nucleus. Ophthalmo is eye, so ophthalmologist. Right? Osteo is bone, so osteopath would specialize in bones. Auto, ear. Patho is disease. Peritoneum. Phago, to eat or swallow. Phleb, so a phlebotomist is actually taking blood from the vein, right? A phlebotomist. Plasma or plasmo formation. Pleuro is pleura. Pneumo is lungs, so pneumonia would affect the lungs. Pulmo is lungs, pulmonary. Radi is x-rays. Rect is rectum. Rein is kidney. Rhino, so rhinovirus. You've heard of rhinovirus. Or rhinitis is a runny nose. Sarco, flesh. Spleen is spleen. And staphylo is clusters. So Staphylococcus aureus. So they're found in clusters. Strep, twisted chains. So streptococcus. And you've heard of streptococcus, right? So they're twisted chains. thoraco, chest, thrombo is a clot, tonsil is tonsils, trachea is tracheo, and veno is vein. Now, you want to, so those are the combining forms of, remember O is, and here, strep. But then you always want to start with suffixes, right? So the way that I taught you in the beginning is you want to go from backwards to forwards. So you know that algia means pain, cele means hernia, centesis is puncture to remove fluid, coccus is a berry-shaped bacterium. Right? So you had streptococcus, that was the word, and then cyte means cell. So these are suffixes. Make sure you know suffixes before you know combining words. That will help you. Alright, so then as we go into dynia, that's pain. So if you saw the word pleurodynia, you know that pleuro means what? Lungs, and then dynia means pain, so pain in the lungs. So now you're understanding how to combine these. Ectomy is excision, removal, resection. You can put anything in there. I could put laryngectomy. What would that mean? Removal of the larynx, right? Emia is a blood condition, like anemia. That would be decrease in erythrocytes, right? A meaning decrease. You've got Genesis. Remember the old school game Genesis? You had Atari, Genesis. Now you know I'm old. But yeah, that's where Sega Genesis. That's where Sonic the Hedgehog. Anyway, condition of producing and forming. So let's say you had the word pathogenesis. That would mean condition of producing disease. Right? And a gram is a record. That's right. So like a mammogram, that's a record of the breast. See? So now you're understanding that. A graph is an instrument for recording. So like electrocardiogram or electrocardiograph. Electroencephalography or electroencephalograph. So graphy is the process of recording, but the graph is the actual instrument. Okay. Itis is the itis brothers. We always talk about itis brothers. So bursitis, tendinitis, arthritis keeps most of the medical professionals in business. Or the itis, arthritis is probably the one that you've heard of the most. But it's you can add itis to anything, and it could be inflammation. I mean, you could get bronchitis, tonsillitis. You name it, cystitis. It's anything is inflammation. So make sure you know itis. Logy is the study of. You can add that to anything, you know, biology, physiology, you name it. Terminology, ophthalmology. Lysis is breakdown. So you go hemolysis. So lysis meaning what? Breaking down. Hemo meaning blood. So destruction of blood. Hemolysis. Malaysia is softening. So you've heard of chondromalacia. That's softening of what? Cartilage. Chondro meaning cartilage. Megaly means enlargement. So if you had an acromegaly, that's enlargement of the extremities. If you have a splenomegaly, that would be enlargement of the spleen. Tuma, mass collection of fluid. So that's an oma. So myoma would be a benign tumor of the muscle, or a myosarcoma is a tumor malignant of muscle. Okay. And opsy is to view, so a biopsy, that's the most common biopsy, to view life. And osis is a condition usually abnormal, so if you had necrosis, that's condition of death of cells. Pathy is any kind of disease. So let's say we get cardiomyopathy, that would be disease of heart muscle. Deficiency is penia. So leukopenia, erythropenia. Leukopenia would be a deficiency of white blood cells. Phobia, you have a fear. There's lots of phobias. Hydrophobia, acrophobia, arachnophobia, that's fear of spiders. Plasia is development, formation, or growth. So you get chondroplasia, which is no development of cartilage. And then plasty is surgical repair. So rhinoplasty, you name it. Angioplasty would be surgical repair of blood vessels. Topsis means drooping, falling, prolapse. So visceroptosis is drooping, sagging of the internal organs. That can occur. Rhea, flow discharge. You've heard of diarrhea, of course. That's a flow discharge. Hardening. So arthrosclerosis would be hardening of the vessels. Scope, instrument for visual. So laparoscope, endoscope. Scopy is the process. Remember that you add a Y there, and it's the process of examination. So laparoscopy is the process, but a laparoscope is the instrument. And stasis is controlling, or so metastasis is beyond control. But hemostasis, hemostasis would be stopping the flow of blood. Homeostasis is what your body is always trying to get into, is trying to have a balance. Ostomy, opening to form a mouth. Okay, colostomy, new opening on the colon, you've heard of that. Therapy is treatment. Hydrotherapy, chemotherapy. So hydrotherapy is treatment with water. Chemotherapy is treatment with drugs. Tomy would be incision, cutting into. So incision into the abdomen. Development, nourishment. So if you had atrophy, you would have no development. Which term means fear of heights? So you know it's one of these fears: hydrophobia, acrophobia, or agoraphobia. So you want to know which one that is. That's a good question. You know it's not this one, so you can, hydro you know is water. So then if you didn't know, you just got to see C or D. You know acrophobia is fear of extremities, so break it down, which one it would be. Alright, is one who. Okay. So examiner, one who examines. Ia is a condition. So pneumonia, condition abnormal of the lungs. Leukemia is a conditioner of increase in white blood cells. IST is a specialist. There's tons of specialists: neurologist, orthopedist, you name it. Ol is little or small, like an arteriole is a small artery. Ule is little or small, so like a venule is a small vein. Ium is a structure. Pericardium is a structure surrounding the heart. Us is also a structure of substance. And then Y is condition, process. So nephropathy, disease of the kidney. Now this suffix also means ac or ac is pertaining to, al pertaining to, are pertaining to, are pertaining to, eel pertaining to, and genic pertaining to. So all these are great. They all mean pertaining to. That's all they mean. So you have a suffix that ends with ac, al, ar, let's repeat, eal, and genic. Well, that is definitely all just meaning the same thing, pertaining to. And ick, pertaining to, is also. Oid is resembling. Okay, so adenoids, resembling glands. Os, pertaining to, full of. Adipose, pertaining to fat. Us, mucus, pertaining to mucus. Tick, pertaining to. Necrotic, pertaining to death. So look at all these suffixes that all mean just pertaining to or resembling. AC, AL, AR, EAL, genic, ick, oid, os, tick. All mean the same thing. So this is a good area to concentrate and say, wow, I didn't know that all that just meant the same thing. So again, building terms with suffixes and combining forms. Now let's put it together. Arthritis, inflammation of the joint. Blephar, atelectasis, drooping eyelid, ischemia, loss of normal blood flow, osteogenic, produced by bone tissue, staphylococci, berry-shaped bacteria that grow in clusters. So a closer look, what is a hernia? Protrusion of an organ or the muscular wall of an organ through the cavity that normally contains it. A cytocele versus a rectocele. Okay, so a cytocele, which is the urinary bladder, and a rectocele, which is of the rectum. So, okay, so protrusion of an organ or the muscular wall of an organ through the cavity that normally contains it. Okay, cysto, remember cystitis means urinary bladder, and recto meaning rectum, and so the seal right there. So, what is a rectocele? It's a herniation of the intestine, protrusion or portion of the rectum toward the vaginal wall, hiatal hernia, or omphalocele. So the answer would be B. And streptococcus and staphylococcus are bacteria that grow in chains or clusters. We want to look at blood cells. Erythrocytes, red blood cells, leukocytes, white blood cells, and thrombocytes or platelets are clotting cells. Make sure you know the difference. Erythrocytes, again, red blood cells made in the bone marrow, carry oxygen from lungs to all body cells. Hemoglobin is a blood protein. Leukocytes are white blood cells. 5 different kinds of leukocytes divided into 2 different categories. They're either granulocytes or mononuclear sites. So when you do a CBC, which is your complete blood count, you're monitoring how many erythrocytes you have, how many leukocytes you have, and if you have an influx of leukocytes, you might have some kind of infection. And then you can break it down and see neutrophils and eosinophils and say, well, if you have a high rate of eosinophils, what does that mean? Again, that's going into anatomy, but at least you're building the foundation. Granulocytes, 3 types, eosinophils, basophils, and neutrophils. Then you have mononuclear nuclear cells, 2 types. You have lymphocytes and monocytes. Alright, so here's the leukocytes, which are white blood cells, and they're divided into granulocytes and mononuclears. And then you have eosinophils, basophils, and neutrophils, which are granulocytes. And then you have mononuclears, which are lymphocytes and monocytes. Cyte meaning cell. Thrombocytes, also known as platelets, tiny fragments of blood cells that are formed in the bone marrow, necessary for blood clotting. And then here's a closer look at the bloods. Here's erythrocytes, which contain no nucleus, but contain hemoglobin, which is a protein. Then you have the granulocytes, which is the eosinophils, granules. If you actually have a high rate of eosinophils, you can either have a parasitic infection or allergies. So people sometimes that get their blood work done, if they have high eosinophil count, they have a tapeworm or a parasite in them, or they have allergies. Interesting, right? So you have a basophil and then neutrophil, and then the mononuclears are the lymphocytes, monocytes, and then you have thrombocytes right here. Quick quiz, hot shot. Remember Speed with Keanu Reeves? Love that movie. Which type of blood cells are necessary for clotting? And you know from studying that's the thrombocytes. Closer look. Acromegaly, which is endocrine disorder, occurs when the pituitary gland produces an excessive amount of growth hormone after completion of puberty. Often results from a benign tumor of the pituitary gland. Person typically is of normal height, but bones and soft tissue in the hands, feet, and face grow abnormally. Abraham Lincoln actually was believed to have acromegaly. I don't know if you ever watch wrestling, but a lot of the wrestlers have acromegaly. So here's some WWE wrestlers, the Great Khali and Andre the Giant, which fortunately I think he passed away, and most of them usually pass away at an early age just due to the demand on the heart. So this is the Great Khali. Alright, what's a laparoscopy? A laparoscopy, depending on where your accent is. Laparoscopy, a form of minimally invasive surgery, visual examination of the abdominal cavity using a laparoscope, a lighted telescopic instrument. Surgeon inserts the laparoscope through an incision in the abdomen near the navel, used to examine abdominal viscera for evidence of disease or for various procedures such as the gallbladder, and that's what a laparoscopy looks like. And then we end with adenoids, which are a closer look. So they're right above the soft palate right here. They're small masses of lymphatic tissue located in the part of the pharynx near the nose and nasal passages. The literal meaning means they resemble glands, is appropriate since they are neither endocrine nor exocrine glands. So adenectomy, again, depending on where you put the accent, may be needed if they become enlarged and block the airway from the nose to the pharynx. All right, hopefully that helped.